One of the darkest chapters in United States medical history, a cruel experiment that lasted 40 years, also known as the Tuskegee Syphilis Study. Beginning in 1932, government researchers from the Public Health Service and the CDC recruited 600 poor black men from Macon County, Alabama, 399 who had syphilis and 201 who didn't, telling them they were being treated for bad blood, a catch-all term locals used for various illnesses. In truth, the men were part of a secret study on how untreated syphilis progresses in the body. Even after penicillin became a standard cure in 1947, the researchers deliberately withheld treatment and lied to the men, never telling them they had syphilis. They were given placebos, spinal taps disguised as therapy, and vague assurances of care, all while the disease ravaged their bodies. Over the decades, at least 28 men died directly from syphilis, more than 100 from related complications. 40 of their wives were infected, and 19 children were born with congenital syphilis. Researchers blocked draft boards from treating infected men during World War II and even discouraged local doctors from prescribing penicillin. The study was finally exposed in 1972 by whistleblower Peter Buxton, sparking public outrage and congressional hearings. A class action lawsuit in 1973 resulted in a $10 million settlement, and in 1997, President Bill Clinton publicly apologized, calling the experiment shameful and racist. The men had never consented to being studied and were used without regard for their safety, rights, or dignity. Though some received minor medical care and burial expenses as incentives, they were deceived and manipulated throughout. The experiment's fallout led to major reforms in research ethics, including the establishment of institutional review boards and informed consent requirements.